Declaring a state of emergency. Arizona and the opioid epidemic, from overdose to recovery.
You just get to a point where you don't care. You think about the consequences, maybe, but you don't care.
Prescribing pain medication. Are doctors part of the problem?
This is a disease of chronic progression, and you can't just turn off the faucet and expect the disease to go away.
Opiates. Arizona takes on the issue. This is Arizona Week. Hello and thanks for joining us. This week, Arizona Governor Doug Ducey declared a state of emergency. The addiction to opiates in Arizona so severe, nearly 800 people died last year. That's about 2 per day. According to the Arizona Department of Health Services, over the last 4 years, that's a 74% increase. The state says last year of the 1,500 drug overdose deaths in Arizona, more than half were due to opioids. It's reported in Arizona that 4 in 10 adults are addicted to prescription painkillers, and that's how addiction began for one Tucson woman. Jordan Daney is currently undergoing treatment at the Arizona Rehab Campus on Tucson's east side.
When I was 15, I was having really bad back pain, and I went to the emergency room, and they ended up prescribing me Vicodin. And when you have back pain, I mean, anybody will give you anything. So after I decided I liked how it felt, I liked the way it it made me want to do things. It made me wake up. It wasn't like a normal opiate high, I guess. I kept going back to the doctor, getting more, finding doctors that would prescribe it to me.
So then eventually the doctors quit giving you Vicodin?
Yeah, because I didn't have like a primary care doctor. I kind of just doctor hopped. I've gotten like my wisdom teeth pulled, even though they didn't need to be pulled, to get prescription pain medication.
You were able to convince a dentist to take your teeth out just so you could get the prescription meds?
Yeah, twice. The same doctor.
Then you decide that prescription meds aren't doing it for you anymore.
Yeah, well, I mean, because I had gotten sober both times when I got pregnant, and then after that I switched to stronger medication because the doctor had been giving me the Vicodin for the labor pains and everything. And I always told myself, I'm not going to go back to that, not going to go back to that. And then I found out how to steal the OxyContin, the 80 milligram ones. And then eventually those weren't working. I was doing too much of that, so.
How'd you steal the 80 milligram Oxy?
Yeah, it was somebody I babysat for. He would get large quantities of them every month and didn't notice for a while, started noticing a little bit, didn't really, kind of just put his head in the sand. So I started out just taking a little bit off of the 80 milligram one and I'd be fine. And once I stopped taking that, it was like 4 or 5 of the 80 milligram ones a day and smoking like 5 or 6 of the blue 30 milligram Percocets. And it didn't get me high anymore. It was normal. That was my normal.
How'd you find your way to heroin?
It was a coworker, so I was still taking pills. I actually moved in to this place when it was the Ramada, and we were staying in one of the rooms, and I was running out of pills, and we would take pills together. And he kept telling me, he was like, I can get heroin, and because I tried it about 5 years ago, and told myself I'd never touch it again because I loved it. And I told him no. I was like, no, I don't want to do that. Told him no for a few days, and finally I was like, I can do it. I can do it again. I did it before, and I didn't get addicted.
It was easy for you to get heroin. It was easy for you to get drugs on the black market. Is it that doable in Tucson?
Yeah, Tucson heroin's huge in Tucson. You can literally, honestly, probably go anywhere and ask like 1 in every 3 people. You can find somebody that looks maybe homeless or looks stereotypical like a heroin addict or a drug dealer and ask them, and they will more than likely be able to tell you where to get heroin.
How many times have you overdosed in your life?
On heroin, I've overdosed once. On pills, a lot. I've overdosed. I don't know a specific number. It was like 3 to 4 times a week for a while, a couple months probably. I have collapsed veins everywhere. When I went to the emergency room this last time, they couldn't hit my veins. They had to do it like 5 or 6 times, and it was really painful. It really sucked. It's really ugly. It leaves scars. I mean, they look just like track marks. They're black lines down your arms.
You said your ankles too?
Yeah, I've shot in my ankles more than once. I've shot up in my neck. I mean, like I said, you'll do anything to get that next high.
Earlier you mentioned a pregnancy. You have 2 children. Did you
Yes.
ever think about losing them?
I did. I thought about it. I didn't care. It's really, really bad to say that. I love them with all my heart, and I've never not loved them, and I would always do absolutely anything for them. But you just get to a point to where you don't care. You think about the consequences, maybe, but you don't care.
You know, there are people who are probably watching this and thinking, how can a mom say that? But these drugs, from what you're telling me, are so powerful that they make you feel that way.
They do. I mean, you don't care about anything. You'll steal from your family. You'll lie to your family. You'll give up on your kids. You'll give up on yourself. You lose yourself 100%. And I think that's the biggest part about heroin addiction, is that you completely lose yourself, and you can't. It's hard to find that person again until you get clean.
You're in rehab right now.
Yes.
You've been in rehab before.
I've been in detox before.
Okay. What's different this time?
This time it's different because, I mean, every other time I would tell myself, I'm going to lose my kids, I got to get clean. And every other time I was relapsing as soon as I got out of detox. I already had a plan, how I was going to go get dope and get high. This time I've finally realized, it took a lot, but I realized that I have to do it for myself, and I have to find the love I have for my children, like in myself and for myself. And until I do that, I'm not going to be able to give them the life they deserve. I'm not going to be able to stay clean because I don't know. I feel like if you're not genuinely happy, and if you can't find genuine happiness and love for yourself, you can't give that to anybody else.
This was tough for you to do. I mean, to go on camera and share your story. Why'd you agree to do it?
I agreed to do it because this is completely out of my comfort zone. I don't talk to people. I don't, especially not cameras and all the jazz. I kind of decided I was going to step out of my comfort zone, and I'm hoping I can reach out to somebody who has a similar story and maybe give them hope and maybe help them, and hoping they can maybe help somebody else and just cause a positive snowball effect.
Across the country, every year, 40 to 50,000 people die as a result of addiction to prescription pain medications and drugs like heroin and fentanyl. Dr. Len Dittmanson is an internist who treats patients all over southern Arizona.
Opiates refer to substances, chemicals that are derived from the opium poppy plant itself. The latex, kind of a milky substance that comes out of the pod of the beautiful opium poppy, has ingredients such as morphine sulfate and codeine that then can be used to convert into other opiate chemicals like oxycodone, hydromorphone, and some of the opiates that we use in medical clinical practice. Opioids are synthetic derivatives or lookalikes of the opiates and include fentanyl, methadone, and several other ones that are available.
And this problem that we're seeing has really started with prescription medication.
That's correct. About 20 years ago, there was a change in medical culture that suggested that we be more aggressive in treating acute and chronic pain using these opioid medications. And we created a large population of people that were managed with long-term opiate and opioid medications. And that's where we're seeing the problem now, because a lot of those people with this addiction, this chemical dependency, are shifting to the use of heroin and fentanyl and other illicit opioids.
In your line of work, you treat the whole gamut of patients.
Oh yeah, it knows no socioeconomic, demographic boundaries. It affects younger and younger people, middle-aged people, older Americans who have been maintained on opiate medications and now are facing this problem. Genders are about the same now, about 50-50, and it's just it's 1 degree of separation. Everybody knows somebody with this problem.
And it didn't just start, I mean, as you said, this is going back to for 20 years now. But with this declaration from the governor and the health department saying that we are at an epidemic now, what does this mean? Where do we go from here?
Well, about 5 years ago, we really saw the alarms starting to go off, and rightfully, state government and national government, the White House, all looked to policies that would reduce the amount of prescription opiates, ostensibly to reduce the number of people who enter this problem, but also to try to cut down on the amounts we were prescribing to people who already had the opiate dependency syndrome. Again, this is a disease of chronic progression, and you can't just turn off the faucet and expect the disease to go away. So now 4 out of 5 people who were taking opioids now are taking heroin.
Can you get off of this addiction? I mean, this illness can't just go away, but it can be treated.
It can be treated. The primary treatments, unfortunately, involve medications that substitute for the opioid they might be taking, such as buprenorphine, Suboxone, or methadone hydrochloride. The problem is that there's a disruption in the chemical nature of the deep limbic brain involving a chemical and a hormone in the brain called endorphin. And endorphin is a remarkable hormone that gives us a sense of happiness and satisfaction and wellness and all the wonderful feelings we feel. The opiate takes over for that hormone that stops being produced, and now in the absence of the opiate, you have this endorphin deficiency that leads to chronic depression, anxiety, sleeplessness, pain, and just miserable state of being.
We talk about heroin and fentanyl. Fentanyl is far more dangerous, more powerful, but it's more accessible now?
Yes, fentanyl is a new problem for us, more so on the East Coast right now, but just in the last few weeks to months, we're seeing it emerge here in southern Arizona as well. Fentanyl is a synthetic, very, very potent opioid that historically we would only use in a hospital setting, maybe to induce deep general anesthesia, or patches that could be used to treat chronic unremitting cancer pain, for instance. Now it's being mass-produced, we presume mostly in China, imported to countries like Mexico or directly into the United States, put into pill form that look very similar to other opioid pills on the street, and it's much cheaper to make because you don't need the opium poppy itself, and it's easy to transport. Often it's transported with little pill-making devices, and that's what we're starting to see now.
What is happening out there that's making this so desirable?
Well, I think people are accidental tourists when they get exposed to this family of substances. Nobody starts taking Percocet expecting or hoping to become a heroin addict. And so it's still a problem with overuse, overprescription, and overavailability of opioid prescription medications. 80% of all the opioids produced on the planet Earth are consumed in the United States. So we're an opiate nation, and the mortality rate just continues to go up as a consequence of that degree of use.
Addiction to opiates affects all walks of life. Here now is the story of a local educator. He started with prescription drugs, then moved to heroin, and then fentanyl. We've agreed to protect his identity because he's worried he could lose his job.
I work with a population in the community that's very vulnerable. I want to protect my good name and my professional opportunities as well, because people don't think about you the same way after they know that you've done hard drugs.
There's a stigma associated with this illness.
Oh, indeed. And that stigma is unjust because heroin and opiates doesn't discriminate based on the person's social economic status or education level or their linguistic, ethnic background. It takes hold of everyone, regardless of where they come from or who they are.
This started with you being in pain and needing prescription medications. How did it snowball into hard narcotics?
Well, that's right. I started using prescription pain pills to treat severe pain that left me incapacitated, unable to function and do daily activities. After a time, I found I was unable to afford the prescription pills anymore. They're very expensive on the street, and so I was forced to turn to street heroin as a substitute. Later on, I was introduced and able to purchase fentanyl, and I turned to that because it was less expensive and lasted longer than heroin did. And so I basically switched over to fentanyl for economic reasons.
How much are we talking? I mean, how much do you get for heroin and fentanyl?
Well, it's surprisingly inexpensive. Street value for a gram of heroin, black tar, can range from anywhere from $30 to $80, depending on who the dealer is and the quality, the strength of the substance itself. Heroin is like a gentler, softer high. It's like lying on a cloud with a warm, fuzzy feeling inside both your body and your mind. You lose all your cares, all your problems seem to go away. It's like you're floating on cloud nine. Whereas fentanyl is similar to a bomb going off and all your thoughts simply go blank. You're in a deep stupor, and that stupor can last for many, many hours, up to 5 or 6 hours.
After you took on these hard drugs, was there a snowball effect in your life? Things changed, got harder to work, harder to function, make friendships with people?
As the disease progressed, I lost the urge, the need, the want to maintain friendships or to make new ones. I lost my drive to go to work, to participate in activities and hobbies that I did before. It basically took all the fun out of my life.
At any point, did you feel that it was irresponsible of you to be on these narcotics and continue to work with children in a school setting?
Well, I never came to work under the influence. I did feel bad because the quality of my work suffered tremendously as time went on, and I kept on using drugs. And I dealt with that by working less and less and doing all I could not to have to go into work and just to stay home and maintain my use of the drugs.
You're in treatment now, you're getting Suboxone dosages. How's that working out for you?
Well, Suboxone is a miracle drug, I think. It not only takes away the sickness, the pain, the misery that goes along with withdrawal, which can last for months. It also stops me from wanting, needing, or even thinking about using narcotics.
Did drugs ruin your life?
Drugs came very close to taking my life. By all rights, I shouldn't be here right now. I should be dead. But for some reason, perhaps it's unfinished business, I'm still here. And that's part of the danger of heroin and fentanyl and prescription painkillers as well, as they are so deadly and people don't realize it. And it only takes a bit too much to put someone over the edge so that their overdose ends in a fatality.
It sounds like you want your life back.
Indeed, I'm getting my life back more and more every day. So I think making the decision to go into a detox program and face my addiction face on was one of the most scariest things I ever did, but also the most important in my life.
When it comes to heroin and fentanyl, here's a look at some of the numbers in Arizona. The Drug Enforcement Administration says in 2015, agents seized 1,540 pounds of heroin. Last year, that number grew to more than 1,800 pounds. DEA saw a substantial growth in fentanyl, half a pound in 2015, then 62 pounds in 2016. Who's to blame for the opioid epidemic? Dr. Douglas Spegman is the Chief Clinical Officer at El Rio Community Health Center, and he says doctors and pharmaceutical companies are partially to blame.
Our guilt is that complicated patients who were experiencing pain, we in a somewhat narrow way medicalized that. What I mean by that is our response was to use pills to help alleviate pain. Where did that come from? It didn't arise out of a vacuum. It came from the reality of the early 1990s, where studies were showing that patients with cancer pain were not receiving enough pain relief. Out of that, what happened was there was a great movement to, and it was right-headed, to assess pain in patients. All patients, not just cancer patients, but all patients. The Joint Commission on Accreditation, which is a large accrediting body, El Rio is one of the few in southern Arizona outpatient facilities that's accredited by the Joint Commission. The Joint Commission, in a way of just trying to move the ball ahead, made suggestions that every patient should be assessed on pain, and out of that came a pain scale, 1 to 10. Well, the unintended consequence is that if you just, in a superficial way, look at that as like a vital sign, and that's something that you have to do something about. The risk in a system that is very dependent on the provider visit, which, is maybe 15 minutes, even if I know you well, maybe I'll see you 4, 5, 6 times a year. Well, in the cumulative hour and a half that I've seen you, how can I really manage what's happening, right? And in this case, it was giving pain relief by pills. The other factor is pharmaceuticals. So the pharmaceutical growth in the early 1990s to now, with other synthetic types of opioids that are out there, just skyrocketed. So, if we're assigning culpability, it's also the heavy investment with pharmaceuticals in opiates that also happened.
This week, Arizona Governor Doug Ducey declared a state of emergency, a declaration to get the health community, law enforcement, and others on the same page when it comes to tackling the crisis now considered to be at epidemic proportions. Stephanie Innes is a health reporter at the Arizona Daily Star.
The state of emergency was, it is unusual. It's the first time they've done that in about a decade, or at least a decade. And in southern Arizona, so statewide, we've got 2 or more people dying every day from opioid overdoses. And in southern Arizona, a few years ago, opioid overdose deaths started outpacing deaths by motor vehicle accidents, which shows you the problem. And we've had several doctors disciplined for overprescribing opioids. So yeah, it is a problem locally. I spoke with Police Chief Chris Magnus yesterday about this, and talked about the state of emergency. And he said, yeah, it's good that they're doing that, but this is something that local people, law enforcement, have been dealing with for at least a year or more. All of our police officers already carry naloxone, which is a drug that blocks the opioids and can prevent an overdose. So I think Magnus and others are waiting to see what this emergency declaration actually will mean. But from what I know, it includes more coordination with law enforcement and with the hospitals to get better data on people who are overdosing. I know one statistic is that people who overdose have usually visited a hospital, at least ER, at least 3 times.
Before.
So trying to get more identification of who the drug users are.
Is there any indication right now that because we're closer to the border, it's a bigger problem in Arizona?
Well, that's an interesting question. So most heroin is smuggled into the U.S. through the southern border. So that would indicate that, probably yes. I think that what happens with the opioid abuse is that people are prescribed, they're just professionals, regular people are prescribed painkillers, and then they become addicted, and then they turn to the black market, and they buy prescription drugs on the black market, but if they can't get them, then they turn to heroin. And I know that, if it's coming over the southern border, it's probably, and I don't know this for sure, but I'm assuming that it's more plentiful here just because of our proximity. I do know in interviewing some drug abusers and some heroin addicts, I did interview one who had moved here from Michigan because she said the heroin was easier to get and cheaper. But that's anecdotal, so I don't know that that's for sure. But the other thing is, the fentanyl, which is being smuggled by the Sinaloa cartel, and that's coming from Mexico, and that's a very powerful opioid that is fueling a spike in opioid-related overdose deaths.
And far more dangerous than morphine. More powerful.
Yes, very much more powerful. And sometimes people don't even know they're getting it. They buy the heroin and it's got some degree of fentanyl in it. And they do that because it makes you get more hooked more easily on the drug. So people don't even know that they're getting the fentanyl, and it is causing more deaths.
Does this week and last week's discussion with the health department, does it awaken a sleeping giant? I mean, this is something that, as Chief Magnus told you, it's been here.
Yeah, you're right. It has been here for a while, and it is affecting, it's affecting not just the people dying of overdoses, but their families. And one of the things we've looked at is the babies that are born. I know in 2015, which was the last data I could get, it was 450 babies born with some kind of neonatal abstinence syndrome, which is, drug exposure. And increasingly that's opioids. And the number of babies born with that NAS has been rapidly increasing. So, it's affecting all walks of life.
And that's our program. For all of us at Arizona Public Media, I'm Lorraine Rivera. Thanks for joining us.